Hello and welcome to Crack the Board. In today's video, we will have a look at questions related to behavioral science. Question number 1. A 33-year-old man presents to a psychiatrist after his partner expressed concern about his excessive hand washing. He spends nearly an hour each day scrubbing his hands, fearing they are contaminated with germs. He repeatedly washes his hands even when he knows they are visibly clean. At work, his hand washing disrupts his productivity as he frequently washes his hands during meetings and becomes anxious if he cannot do so immediately after handling items. He is aware that his behavior is excessive and illogical, but he feels a strong sense of relief after washing his hands. His partner has urged him to seek help as it interferes with their daily activities. Which of the following is the most likely diagnosis? A. Adjustment disorder. B. Autism spectrum disorder. C. Obsessive compulsive disorder. D. Obsessive compulsive personality disorder. The correct answer is C. Obsessive compulsive disorder. This patient has behaviors consistent with obsessions and compulsions that impair his daily function. The compulsion, the action performed to relieve the obsessions, are characteristics of OCD. This patient demonstrates obsessions related to distress when there is cleanliness or he feels there is germs, and the compulsion is to wash his hands in order to relieve these obsessions. Let's have a look at why the other options are incorrect. Option A is incorrect because adjustment disorder refers to symptoms of anxiety or depression within 3 months of a significant life change, which in this question there is no mention of this, and also the patient does not have any known stressor. Hence, his symptoms are more consistent with obsessions and compulsions. Option B is incorrect because part of the symptomatology of autism spectrum disorders include repetitive restrictive behaviors such as inflexible adherence to routines and distress when such routines are changed. However, in autism spectrum disorder, it must occur in the context of deficits in social interaction of a person and the social communication of the person. In this question, there is no such evidence that this patient is having an impairment in his social communication. Hence, this rules out the diagnosis of autism spectrum disorder. And option D is incorrect because individuals with obsessive compulsive personality disorder, they apply structured rules and rituals to their daily routines, but they do not usually perform compulsive acts to relieve obsessions as seen in obsessive compulsive disorder. So that is the difference between option C and D. In option D, they do not perform the compulsive acts. Let's have a look at the second question. A 45-year-old man with a strong family history of cardiovascular disease visits his primary care physician. He is concerned about his risk of heart attack and asks whether he should undergo advanced cardiac screening, including a coronary calcium scoring. The patient asks What do you think I should do? The cardiologist responds, I can guide you based on the evidence and discuss the pros and cons of each option, but ultimately the decision is yours to make. Which ethical principle does this case illustrate? A. Autonomy. B. Beneficence. C. Confidentiality. D. Justice. E. Non-malfeasance. The correct answer is A. Autonomy. Autonomy refers to the right of patients to be in charge of their own care and make their own decisions. Let's have a look at why the other options are incorrect. Option B is incorrect because beneficence is the act of doing what is best for the patient. But this was not the scenario in our question. And option C is incorrect as confidentiality means the information of the patient should remain confidential unless in exceptional cases which is ethically required. In those exceptions, the doctor can disclose patient's information. For example, if during a consultation, the patient verbalizes to the doctor that he does wish to harm someone, to harm a specific person. Now, in that case, the confidentiality should be overridden and the concerned authorities should be notified. And option D is incorrect as justice means it is the distribution of health resources fairly, even if scarce. This and the decision about who should receive the resources should be just and fair. And option E is incorrect as non-malfeasance is from the Hippocratic Oath, which says that the practitioner should do no harm to the patient. Let's have a look at the third question. A 28-year-old man presents with a 5-year history of chronic headaches. He describes them as dull, persistent pain that fluctuates in intensity but never fully resolves. Extensive diagnostic testing, including imaging studies and laboratory tests, has not identified an organic cause. Despite numerous trials of analgesics and other treatments, his relief has been minimal. He's not intentionally producing the symptoms and expresses moderate frustration about the lack of improvement and denies any significant anxiety, depression, or other mental health concerns. Which of the following is most likely the diagnosis? A. Factious disorder. B. Major depressive disorder. C. Malingering. D. Somatic symptom disorder. E. Conversion disorder. The correct answer is D. Somatic symptom disorder. This is characterized by one or more distressful or significantly disruptive somatic symptoms that are accompanied by excessive thoughts, feeling, and behaviors related to somatic symptoms. In this case, the man's excessive experience of persistent pain best fits this diagnosis. Let's have a look at why the other options are incorrect. Option A is incorrect because the cardinal feature of a factious disorder is deliberately producing symptoms in order to assume a sick role. There's no other additional external incentives apart from gaining that sick role. For example, a patient with infectious disorder might intentionally inject feces into his or her body to create an infection that would lead to hospitalization. Or another patient would maybe, just inject insulin into himself, so he would develop hypoglycemia and get admitted in the hospital. So that is for factious disorder. And option B is incorrect because although depressed patients often present to their physician with somatic complaints, the disorder most prominently impacts mood. And to diagnose a major depressive disorder, the patient must have 5 symptoms of depression, and one of them has to be a depressed mood or anhedonia for at least 2 weeks, and functional impairment must be displayed. And option C is incorrect because malingering implies that there is deliberate attempt to produce symptoms because of some external gains and incentives, such as, for example, a person gaining money by acting in a certain way sick, or they can avoid certain responsibilities by acting sick and presenting with certain complaints. So that is for malingering. And option E, conversion disorder, is also not the right choice because individuals with conversion disorder, they develop pseudo-neurological symptoms like altered voluntary, motor, or sensory function in response to stress. They can present in a way like inability to speak or hear. And in this question, the experience of pain in this present case is not considered a conversion reaction, but rather it is part of a somatic symptom disorder. And this concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content and to support our journey.